Wait, melatonin causes a 90% increase in heart failure? So a new study actually just looked at over 130,000 people and followed them for a year who were using melatonin every day and chronically for insomnia. And they found something that was related. They're not saying this one thing caused the other, but they're wondering and asking, why is it that folks that seem to be taking melatonin chronically also have an association of increased heart disease? Now, this wasn't a peer-reviewed study just yet. This was an abstract that was presented at a conference that will get into it more, but it raised the question. And the number one thing I'll get into is that when people ask me as a psychiatrist, what is the best tool for sleep? It's actually not a medicine. The best tool for sleep is something called cognitive behavioral therapy for insomnia. In other words, our sleep hygiene. Our sleep routine, how much caffeine we have, how much screen time, what happens when we're going to bed, what we do throughout the day that changes our sort of mood and energy level. All of those things, if we can manage them and scale them, all of those impact our sleep quality at night. So the takeaway I would take here from this study is we're not saying melatonin causes heart disease, but we are saying maybe the supplement that you think you take that is totally benign and is totally safe may not be. So before going to a medication or even a supplement, which is also a multi-billion-dollar industry, first evaluate what could I do to change my sleep patterns on my own. What are some things that I can do? The same way we look at our hygiene physically, right? Showering, washing our hands so that we don't get germs on our hands, that kind of stuff. There's sleep hygiene, making sure that we have sleep that's clean. And one of the ways that we do that, minimizing our screen time, at least an hour before bed, that we're not looking at our phones on TikTok. Looking at our sleep routine, going to bed at a reasonable time that's predictable each day. Our body wants a routine. Minimizing caffeine after noon, because our body doesn't want to be able to break down that caffeine over the course of the next 10 hours. Just a couple of those simple changes can go a long way in having better sleep. What are your best tools?